What are 3 simple things you could do right now to increase your case acceptance? That's what I want to talk about in this week's tip. One of the things I've found over the years in working with clients, you can see from the color of my beard, I've been working with clients for quite some time. It's been close to 3 decades now. But one of the things I've found with working with clients is, if you have a client who has a lot going on, they're somewhat overwhelmed, they have a lot going on in their practice, maybe they're having staff problems, whatever it might be. The more you give them to do, sometimes the worse it gets because they're already overloaded. So now you're giving them 20 things to do and they come back and they get nothing done. Usually in that kind of a situation where someone's just very overloaded or overwhelmed, I'll give them 3 critical things to do. They can do those, they can have a win, and it starts to build on itself. So in that same vein is how I wanted to do this week's tip. There's a lot of things we can teach you here at MGE about case acceptance, and here comes my shameful plug. There's things like the MGE Communication and Sales Seminars, which are the premier seminar event when it comes to increasing case acceptance in the dental industry. There's all kinds of training we have on the subject, but obviously I'm not going to teach that to you in I don't know, however long this tip runs, a 5 to 7 minute tip, hopefully in that range. So what are 3 simple things you could do right this second? The first thing you can do to increase your case acceptance is create time to sell. And yes, I use the word sell. Most people are okay with this now. Back in the day, people used to have a real button on using the word sell with relation to healthcare. But essentially, you're asking somebody to do something and asking them to pay for it, and they're buying something from you, so you are selling. But you need time in order to sell. In dentistry, we create time to diagnose treatment, and we create time to actually deliver treatment. It's very well represented on the schedule. Time to sell is not usually represented on the schedule. So how could you start creating time to sell right this second? Well, there's a few things you can do. The first thing I would suggest is that you actually start blocking off what we might call consult time in your schedule. Where do you want to block this time off? I would recommend you block it off first thing in the morning and first thing after lunch. Let's say the average treatment presentation takes you 20 minutes, then book up enough time like for 2 of those in the morning, 40 minutes, and then you book 20 minutes after lunch to do a treatment presentation. We'll call that consult time. You might go, well, usually when you're thinking of a consult, you're thinking of a big case, an all-on-X case or an FMR case or something big, right? Well, let's just run the numbers on this for a second. If someone comes to you and they need $7,000 worth of treatment and they make $75,000 a year, you're essentially asking them for almost 1/10 of their income. You need time in order to do that. As a thought experiment, let's say, think of what you make in a given year. If I were to ask you to spend that money in 5 minutes, you might not do it. You might need some time to have me explain it to you a little bit better, answer your questions and things of that nature. So as the doctor, you need time uninterrupted to be able to sit down with the patient, explain what it is that they need, and I'll get into that in a second, and actually get them to the point where they understand the treatment plan that they need, and that time needs to be represented in your schedule. Because you look at the way it usually runs with a new patient, for example, you might have an hour scheduled, whether you see them or the hygienist sees them. You go and do your exam. By the time you're done, you have maybe 5 minutes. If this is a large case, you don't have time to present the case. Same thing with a patient of record. Patient of record might need, let's say 4 or 5 inlays as an example, and maybe you talked to them about it the last time they were in for their 3-month recall. Well, now they're back. Well, you only have 5 minutes again to talk to them if you're even seeing them that day. You need time to see this person, so you block time out where you shuttle these patients, usually within 1 to 3 days, don't extend this, where they come back, they sit down with you, you explain their treatment plan, answer their questions, and you actually have time to close that case. As a matter of fact, I'll tell you this, and this is something I tell clients, if you don't have time to properly explain a case and close it, don't start explaining it. It's actually going to make things worse. You're going to send me off with a bunch of questions, and you will probably not see me again, or it's going to be real hard to get me back in. So that's the first thing you could do. Start creating time to sell in your schedule. What's the second thing? Well, let's simplify the presentation process itself. So let's set this up. You have time to present a treatment plan. And again, just to add to what I was just saying, if you have time that day, present it that day. Don't always bring them back if you don't have to. And again, if you bring them back quickly. Don't put it out a week, 2 weeks, etc. But when you're presenting the case, let's keep this real simple. Here you are, the doc, you're sitting down with the patient, maybe your treatment coordinator is there with you. What are you going to cover with this patient? Assuming you have a decent rapport with this patient, you're going to keep, number 1, the jargon very simple. Do not bring up periapical radiolucencies. Okay, a patient doesn't know what that is. Patients don't know tooth surface names. They don't know the buccal or the distal surface of a tooth. And the funny thing is, if you use terminology like that, maybe you've done it before. You'll see that momentary lack of recognition on the part of the patient. It's almost this blank look, like this, right? And I don't know if you've ever followed that up with a question. Did you understand what I just said? What does the patient always say? Oh, yeah, makes sense. Do you have any questions? Oh, no. I've seen this as a lecturer for years. I'll see someone who's obviously confused, and I'll ask, do you have any questions? No. I don't know why people don't ask questions. I can only assume maybe they don't want to look dumb or something like this. Obviously, I wouldn't consider somebody dumb if I'm the supposed expert and I'm explaining something to them. I would expect them to ask me questions. So to sort of preempt that problem, don't use terminology that's going to create those questions because they have no idea what you're talking about. Use simple terminology. Don't say abscess, say infection. Things that they're going to know. That's the first thing. And then how should your treatment presentation run? It's very simple. You're going to go over, here's what you found, here's the problems. And I do recommend, you've probably heard this before, using as many visuals or things as you can. Models, old lab cases, pictures are great if you've got the intraoral camera and you can show them, right? That shows them, especially a tooth looks real bad on an intraoral camera than when, just looking in the mirror in the bathroom. It's lighted up and close up and they can really see what's going on. And they start to get more understanding of what the actual problem is when you're showing it to them on screen. So that's the first thing. Here's the problem. Then the second thing is, here's what you want to do to fix it. I want to do this, I want to do this. And you have to explain it in a way where they really get it, okay? That's the second thing. The third thing, what's going to happen if we don't do anything about this right now? Because you're obviously wanting them to do something about it now. Why should we replace that missing tooth? What happens if we don't do this crown? They need to understand that. These are the potential consequences. And be truthful. If you don't know if a tooth's going to crack, don't say it's going to crack. If you think it might crack, tell them you think it might crack. I leave that up to you and your professional judgment. The last thing is, why do I want to do it now as the doctor? Why do we want to get this done now? And then after that, you're going to wrap it up because at some point either the patient's going to ask you or you're going to tell them the fee for the treatment plan. And this is where a lot of people go, do I have to mention the fee? I cannot tell you how powerful it is when the doctor tells the patient the fee. It's something that we tell every MGE client to do after their first seminar, or at their first seminar rather. Explain the fee to the patient, okay? And the reason being, if you want just a little confirmation on this, ask your staff who a patient is most likely to listen to in the practice, and they will tell you the doctor. Uniformly, I've never heard anybody say anything different. And to sort of convince the seminar attendees when I bring this up, any staff in the room, I'll ask them, who's the patient most likely to listen to? The doctor, in unison, every single time. So when the doctor tells the patient the fee, it is more powerful. Now, a couple of things on this. So let's say I've got my treatment coordinator here, and I've explained the treatment plan to the patient, and I've given them the fee. Okay. And then, and I'm going to give you something to do that you can go over before the fee or after the fee or wherever you feel it is appropriate. I would probably do it before. Let's say the patient says, wow, that's a lot. I just don't really have time right now. I'm really busy. Like you start going back and forth on the money. The next question I would probably ask, and if I could rewind this, I would tell you this. I'd probably ask this even before I gave them the fee is, do you want to do this treatment plan? Do you want to do this treatment plan? Now, why am I asking this question? Well, if the patient doesn't want to do a treatment plan, why are we getting into fees and why are we arguing about fees? If I ask a patient that question and they say, yeah, I guess so. Well, I'm not talking about the fee anymore. Why am I arguing about a fee for something that they don't even know they want to do? So I need to go back and educate them on why they need to do the treatment plan. So to sort of revise what I said mid-video here, you finish up everything that I told you to do, the problem, the plan, what happens if you don't do it now, why we want to do it now, then ask them, do you want to do this treatment plan? And if they go, yeah, I know I need to do it, yes, I want to do it, good. Now go over the fee. In most cases, the patients will ask you how much it is at some point even before that. So now when you've delivered the fee communication, there's two things you can do. If you want to keep it real basic, you give them the fee, the patient might go, wow, that's a lot of money, I don't know how I'm going to afford that, and you go, that's fine. This is why I have my treatment coordinator, Susan, here with us. Susan will work with you and figure out a way that we can get this treatment plan done. That's the most simple option. I personally teach clients to take it a little further. If the patient says, wow, that's a lot of money, I don't know how I would pay for something like that, you might ask them, well, how would you normally take care of something like this? Because then it makes the person think, well, maybe I could put it on a credit card or Could I do a payment plan? Now the person's thinking about how they want to pay. Then you turn them over to the treatment coordinator. Again, I might even take it further. Do you know which credit card you would put it on? I don't want to freak you out too much. I said this was going to be simple, but at least give them the fee and then turn them over to your treatment coordinator. It's very powerful. Again, I have to remember simple, right? Last thing I would recommend that you do is have a morning production meeting every day. Now, what is a morning production meeting? I don't think I have a video about it on YouTube, but I know we have one in our online platform, DDS Success. I'll put a link to it in the video description below. I also have a handout that describes how to do the morning production meeting, not prediction meeting, in the video description below that you can download. The handout is free. The morning production meeting gets your main crew together, your main components of your team, and you're looking at every patient coming in that day and what outstanding treatment they have, and then you work out how you are going to talk to those patients or work with those patients to get them to get going on those treatment plans. That's the basic. There's a lot more to it in the handout. You can read it, or if you want, you can watch the video by clicking the link below. But by doing that, you have an idea of who is walking in that day that has outstanding treatment. And it's funny, you'll see this happen in GP practices. They try to live off of new patients, their implant funnels or their new patients or emergency patients. They think that that's where they're going to get all their production from. Not true. Most of your production should be coming from patients of record, about 70% of your income. That assumes you have a decent hygiene program going and you're a general practitioner, right? This wouldn't necessarily work that way with an oral surgeon. But the whole point is that if you have an idea of who's coming in and when you can talk to them and who's going to talk to them and how we're going to handle this and how we're going to handle that, you start to get a better idea of how to close all those cases. You also have an idea of what's going on in your practice that day. So I definitely recommend that you do one of those. So these three simple, basic things. 1, make time to sell. 2, simplify the treatment presentation process as I explained it. And 3, start doing morning production meetings. If you start doing that this week, I would be shocked. Can't guarantee anything, right? But I would be shocked if you did not see an increase in case acceptance and later in overall production. And look, like I said, we do a lot of training on this subject. If you really want to get good at treatment presentation and treatment acceptance, I recommend that you do the MGE communication and sales seminars. I'll put a link to it below in the video description. Well, that's all I have for you this week. I do hope this helps. And if you have any questions about MGE, you can find us at mgeonline.com or call us at 800-640-1140. And if you'd like to be aware of when these tips come out, as they come out, don't forget to click the subscribe button and the notification bell so you're notified as soon as we release a new tip. Folks, have a great week, and we'll see you the next tip.